The acid in your stomach can sometimes make your stomach eat itself. It sucks. This is Insomniac Anatomy Academy, where I can't sleep, so I study anatomy, episode 143. Your stomach is a very, very acidic place. When it's empty, the stomach's pH is around 4 or 5, which is about the acidity of a tomato. But after a nice big meal, especially one with protein, the pH drops to 1 or 2, which is more acidic than a lemon, but not quite battery acid. Of course, if that acid made contact with your poor stomach cells all the time, they would be utterly destroyed, which is why you have a nice, thick layer of mucus in your stomach. But if you secrete a lot of acid, it can erode that mucus. Then, if you're one of the lucky half of the population that also happens to have the bacteria Helicobacter pylori in your gut, the bacteria can take advantage. They chow down on the rest of the mucus, leaving the poor cells underneath vulnerable to your nasty acid. That's an ulcer, a literal open wound in your stomach. It feels like burning, nausea, and if it begins to bleed, it looks like blood in your poo or vomit that looks like coffee grounds. The causes include having Helicobacter pylori and overuse of specific over-the-counter pain medications called non-steroidal anti-inflammatory drugs, or NSAIDs, otherwise known as why you should not pop ibuprofen, naproxen, or aspirin like candy over long periods of time. You should also not pop acetaminophen like candy over long periods of time, but for different reasons. You're welcome.